Hi you guys, a big warm welcome to the 12th episode of Beauty Doctors by Cocoona with me, your host Nidhi Kumar, and I'm back after a really long break. I hope you all missed me. So this is a time of summer vacations where there are two kinds of people. One who actually are going back to their families and now they're all excited to eat so much food, and then the second kind of people who use this time to lose weight, focus more on their diet. I'm trying to be one of them, but I don't think so. But today, that is why we have on Beauty Doctors Dr. Girish Juneja, who is a director of the Bariatric Center and who specializes in weight loss management, weight management, and also which are surgical and non-surgical procedures. So welcome Dr. Girish to our show.
All right, thanks Nidhi.
Today we will briefly be talking about the various procedures that are available for our audience to undergo weight loss. So weight is a very common problem amongst everybody, amongst even teenagers and adults. So what are the indicators that one should look for before they seek professional help?
Basically, medically we go by BMI, body mass index.
Okay.
Either you calculate your weight and height, and then you divide it, height in square meters divided by weight in kilograms gives a figure. So the maximum 25 BMI is considered normal. So once you cross 25, then you need some kind of help, whether it's a diet or exercise or surgeons like us, some kind of a procedures.
Okay, so 25 is the common for all age groups?
Yeah.
Okay.
Basically from 18 to 25, this is the BMI range,
okay.
normal.
Okay. Okay.
Once you cross 25 BMI, then you have to think to control your weight. Actually, keep it below 25, but once you 25 above, you have to seek professional help.
Of course.
Yeah.
So now there are different kinds of surgeries, like surgical and non-surgical. So how does one decide which is the right surgery for a particular problem?
Yeah. So again, we come back to the body mass index, BMI. So usually 25 to 30 is considered overweight category.
Okay.
30 to 35 is considered obesity grade 1.
Okay.
Now beyond 35 is called morbid obesity, which causes problems in the body, like diabetes, hypertension, those kind of things.
Okay.
So we say that once you cross 35, you need a surgical help.
Okay.
Below 35, above 27 BMI, we can help you by non-surgical methods.
Okay. So as you said, there are many non-surgical methods. So can you please explain some of them that are available to us?
There are now a lot of options are there for non-surgical, varying from ketogenic diet to gastric balloon, and you can say there are permanent endoscopic procedures, non-surgical, like pose. Primary obesity surgery, endoluminal, it is called pose. So there are three varieties, ketogenic from diet to gastric balloons to the pose. So these are the three.
So doctor, now we're going to talk about some of the procedures that you just said. So balloon is something that one can swallow. So can you explain that entire procedure and how does it work?
Yeah. So balloon has lately become very popular because the side effects are less, desired weight loss is good, especially for people who are not very or morbidly obese. For them it's very good. Now basically there are so many kinds of balloons are available now. You can divide them into two parts. One is we place endoscopic and we remove through endoscope. The other is, which you told, swallowable balloon, is called pill balloons. Now pill balloons are easier, and basically two types. One is liquid balloon, one is gas balloon. So the latest in this series you can say is one is O balloon and is called ellipse balloon. Ellipse is the latest one. Very easy. You come for half an hour to the hospital. Under X-ray, you can swallow the pill. It's a very small kind of a pill is there, attached with a string of through which we pump the water. Once you swallow it, we inflate it to fixed volume 550 cc, and we remove the connecting catheter and you go home. And after 4 months, the beauty of this is no endoscopy, no sedation. You come driving, you can go by driving. And after 4 months, the valve opens up, water goes out, it gets collapsed, and it's very thin. It can pass out, down out. So this is becoming very popular because ease of administration and no need to remove it.
And it's a safe solution completely.
Yeah, no need to remove it. Yeah.
So doctor, you also spoke about ketogenic diet. Now that seems tough, but it's absolutely safe and it's a non-surgical procedure. So how does that work?
Ketogenic diet, there are various ketogenic diets available, but what we medically supervise, we do that it's a low carb diet basically. So that your body produces ketones which are utilized by your liver, and you can say, in a grossly fat burning diet.
Okay.
So your fat is burned, fat is reduced. But under our supervision, we give them ready-made, or they can prepare also with water. But there is a permanent backpack kind of a pump is there. So we put a very fine tube through nose in the stomach, 10 days program, and through backpack pump it goes on continuously. It keeps at the desired rate, volume, you can use it, automatically it pumps it. So it's a 10 days program, 24 hours you can keep it also, and results, weight loss is there. Of course not like balloon or pose, but there is a significant weight loss.
So there's an approx how many kilograms do you think a keto 10-day program can reduce?
On an average, in my patients I have seen in 10 days they lose 6 to 8 kilograms.
Wow, okay, that's good. So there's also something called as Botox for stomach. Now it sounds interesting, but how effective is it and is it safe to do?
Botox is very popular for cosmetic purpose.
Yes,
so same, it causes paralysis of muscles.
Okay.
So on that basis we are using Botox for weight loss. Through endoscope we inject into the stomach, and it paralyzes the muscles of the stomach, so the food goes very slowly out, stays longer time. You don't feel hungry for a long time.
Okay.
So it helps in weight loss, but the effect is short duration, around 3 months. You have to inject again. And personally, if I say, then I'm not very enthusiastic about Botox, because a lot of patients, they don't lose. Some they lose good, but some they don't lose. So you have to be careful to choose.
So basically it's not effective for everyone.
No, not effective for everyone. Yeah.
So doctor, just something fun that I would want to ask. So in your entire practice of 10 to 12 years, have you had any special weight loss cases that you would like to share with the audience?
Oh yeah, plenty. I'm doing bariatric practice for last maybe 12 to 13 years.
Okay.
Lots and lots of patients I remember. But if we say...
Any special?
Yeah, there was one cardiac surgeon working with me.
Okay.
So his son he brought.
Okay.
He was 16 years old only and became 150 kilograms.
Oh.
The moment he detected diabetes in his son, so he brought to me that something we have to do it. And as I told you, the BMI 35 onwards, we give a best solution is surgical.
Yeah.
And he was above 35 BMI. So I did a gastric bypass for him. And from 150 kilo, within 6 to 8 months, he reduced to, I think, below 75.
Wow.
And was looking like a boy.
Okay.
Diabetes was gone,
That's good.
disappeared.
Yeah.
But why I remember him is that he went for studies to US.
Okay.
And there he became the football captain of his college team. So I remember that
so
boy.
Nice. Yeah. That is so nice. Is there anything else, any other stories?
Again, plenty, but let me remember one person. He's a nuclear power plant in Abu Dhabi. Yeah. So there was an engineer, Canadian engineer. He came to me. He came for gallstone basically. And I told him that gallstone can be because of obesity. And he was obese. So on further checking and all, we found that he was taking 10 tablets a day for diabetes, for hypertension, and for cholesterol was high, lipids were high. So I did surgery, again the bypass for him. And after 3 or 4 months, he came back smiling. Weight loss was there, of course, and he stopped all the medications. Without medicine, sugar was okay, blood pressure was okay, and cholesterol was under control.
That's perfect.
And he is still following me yearly, pilgrimage to me, my clinic. And till now, no medicine.
That's good.
And 68 kilograms, 2 kilograms above, 2 kilograms down. This is his range.
That's his range.
And healthy, running around, doing his good work, very happy.
Wow, thank you so much, doctor, for sharing these stories with us. Before we end the conversation, is there any beauty tip that you would like to give our audience? Because obviously you're so experienced.
Yeah. See, people are knowing a lot of things.
Yeah, of course.
Now they are
internet.
Yeah, Google, internet, everybody knows. So I cannot give any some secret tip. But I'll say that take care of your diet.
Of course.
Means preferably control your excessive carbs. Put carbs down in your diet. Lead a healthy, active life, which should be regular. Regular exercise and healthy diet. You not necessary that you should be pumping in the gym. You can walk regular. So something regular which you can do regularly and you like it. In long run, that keeps in your habit.
Yeah.
Yeah. So that will control your weight. If you cannot control, if you are obese, if you tried everything, then we are there to help you.
Surely, doctor. Thank you so much for the tip. And of course, the whole point is to be consistent in your diet and in your lifestyle.
Exactly.
So thank you so much for joining us today, doctor. And thank you all so much for coming. And do not forget to watch our next episode because I'll be coming back. And of course, have amazing, amazing holidays and enjoy with your families. And do not forget to tune in. Bye.